Right, it's 20 minutes before 7 here on Morning Line. This is a conversation you really need to listen to. Today is National Bipolar Awareness Day. The theme for the month calls attention to the importance of addressing bipolar symptoms early and working towards better health. The condition is marked by extreme manic highs, and then it's followed by low depressive episodes. But knowledge of the illness leads to acceptance. Now, to share more information on the condition, we are joined in studio by Genevive Powers, who is a senior counsellor at the South African Depression and Anxiety Group. And with us as well, we've got Julian Turner, who is a bipolar patient. Thank you so much for both of you for coming in and joining us here on the programme.
Thanks for having us.
All right. So I suppose the best starting point, Genevieve, is just for people that perhaps don't really know what bipolar is. I mean, I've been given a definition of extreme highs and extreme lows, but there must be more to it.
Bipolar is one of the most difficult mental illnesses to diagnose because of the extreme highs and lows. When people are in the manic phase, they don't often go for treatment and seek out a doctor. You're feeling great, you've got feelings of grandiose, so you think you can do anything and be anything and you're untouchable.
Yeah.
So people don't necessarily seek treatment during that phase. And it's also important for people to realize that a manic phase, I mean, we can go through periods in the day where we feel fantastic and great. To be in a manic phase, it's got to be consecutive days. To be in the depressive phase, it's consecutive days following each other.
Okay.
So for people who think they might be bipolar, keep a mood diary. You can download them off the internet, and it can give you then something that you can track to see, oh, I've been on that high for 2 weeks, and then I've been maybe 2 weeks later in a low for a lot longer time. And then they can go to the doctor and give him something more concrete to help with the diagnosis, because 69% of people go undiagnosed, like Julian was saying.
Well,
earlier.
I mean, Julian, you are bipolar, but what's scary is you were only diagnosed at the age of 46.
Yes, I've been suffering all my life, but I didn't know what it was. In those days, you never spoke about such things as depression, and I experienced highs and lows. And I was always chasing that high, whatever the high may be, maybe going to a soccer cup final or watching a film, and always followed by a low afterwards. Mm-hmm. And this happened for my entire life until 46, and I decided to do something about it because I had to lead a team of a large group of people, and I wanted to be seen as consistent.
So just explain to me, somebody who doesn't necessarily go through it, but what does it feel like? I mean, this extreme high, is it that you've got all the energy in the world and it's almost an unnatural high?
Yes.
And then this complete, I want to stay in bed all day, and so is it two complete extremes?
It's exactly that. In one extreme, you want to be with people, you want to share a joyous occasion. And then on the other hand, you want to be in your room all by yourself. You want to close the door, want nothing to do with the outside world.
Yeah. So you have a family.
Yes.
And through all of it, I imagine, how did your family deal with this?
Well, I've got a beautiful family, a wife. I've married nearly 30 years, 3 fantastic boys. So, bipolar, the most crucial thing is that we are normal people. We have a disability. My wife was very supportive of me, understood who I was, and understood, through my childhood that I got this condition.
Yeah. It got to such a low that you tried to commit suicide.
Yes, it hit such a low in 2014. I felt what I was doing was the best for the family through circumstances. I thought financially they would be better off without me, and I drove all the way to Kloof Gorge, and I threw myself off the cliff, and I fell 80 meters. But there was certainly divine intervention because I was meant to be on earth for a purpose.
Yeah.
And I'm very fortunate to be back in my condition now. All I really have is a damaged leg, but I have a renewed outlook on life.
It's amazing to hear your story, but it's what makes me sad is that there's so many people living with this condition undiagnosed as well, and it can be treated. You can lead a normal life, is that correct? What do you do?
Sticking to your medication and with psychiatric treatment is the most crucial thing for people with bipolar disorder, because staying on your meds makes sure that your mood is stable and that you can live a life without going through the cycles of mania and depression. And it is one of the most difficult things for people with bipolar to do, is to stick to their meds.
Yeah.
So that's where family support comes in, where family members can pick up on certain things, and there might be a certain time of the year that the person normally goes through a manic or a depressive episode, and the family members can be made aware of that, so that they can make sure that the person's on their meds and getting the proper treatment at that time to make sure their moods are stable.
Yeah. Do you find it difficult to stay on the meds? Is that perhaps what led to the event last year?
I think two things, Leanne. The first one was that I was misdiagnosed for anxiety disorder, and I was put on a low dosage of antidepressants. And that's number one. Number two, I never had my medication monitored for 3 years. In fact, 3 to 5 years.
Wow.
And my body got quite immune to it.
Okay.
So I've learned, never ever go off your medication. The medication is part of who I am.
Yeah.
It keeps me the person that I am today.
Yeah. And if it's one tablet that can help you through the rest of your life, and
Yes.
and you pop it in the morning and feel fine, then so be it. I know a lot of
Definitely.
people don't believe in medication, but I suppose it's education, it's diagnosing and speaking to an organisation like SADC that can talk you through it and perhaps help you. 24 hours a day.
Yeah.
Yeah.
Our call centre opens from 8 until 8 every day, 7 days a week, 365 days a year, and then we have an emergency line which is 24 hours as well.
All right. I know that you're hosting a free bipolar Facebook Friday online chat as well. So if you join the Facebook group, you'll be able to also talk about different issues, but it is bipolar this coming Friday.
Yes, it is.
All right, lovely. So join the Facebook group, that's SADC. Please, if you feel any of these symptoms, there's help. You don't have to feel this way, and that's the reality. Genevive Powers, thank you very much, a senior counsellor at SADC, and thank you for coming forward and talking, because even if you just helped one person this morning, that means the world. And
you,
well done to you. Thank you. Thank you so much for being with us. Julian Turner, a bipolar patient, such insightful information about this disease. That's exactly what it is, and it's something that can be treated. Please send us your tweets if you are bipolar, if you suffer from it, or anything you'd like to talk about at Morning Live SABC. Let's take a break.